This is Dr. Rob, and we're back with another Monday 10-minute training. Now, this is going to be kind of a short one, but a probably very useful one for a lot of people because we get a lot of questions about eye goggles and the treatment of eyes with microcurrent. And we all know or have heard of the power of microcurrent for eyes, especially in our community and our training videos. And this all centers around our microcurrent goggles. All of our training pretty much does. Now, microcurrent goggles, for those of you in the know and not in the know, these are notoriously hard for us to get. If you've been around for a while, you've seen the issues with supply and demand. And if you're new, you may not even know they exist because we don't have them at the moment. And while we are working on our own version, which should totally put a stop to that, I got to understand that goggles are by far the most effective option for therapy here. Because they stimulate delivery of the current around the eyes and the pressure points around it as well, and to the eyes. So it's kind of doing it all at once. All of this considered, this has left a lot of people in sort of a holding pattern, looking to treat their eyes, but feeling like they have to wait. All the while, the eye condition, whether it's cataracts or macular degeneration or glaucoma, is getting worse as they continue to wait very patiently for the next batch of goggles to arrive. Now, this doesn't have to be the case. With the delays we've experienced over the past few years getting worse and worse, we have developed simple applications that, while less effective than the goggles by a margin significant enough to warrant still getting the goggles if you can, these treatments are certainly better than doing no treatment at all. So I'm going to share my screen here so I can show you what it is that we recommend. And hopefully you'll be able to see this little mini slideshow that I've put together. So microcurrent treatment of the eyes without the goggles involves two tools: an electrode like the Y electrode, something that you can place on your eye comfortably, and the eye mask, which is a small conductive pad that is designed for use around the eyes. Now, each condition, and this is where the challenge comes in, you just have to look at the training to know the frequencies you need, but each condition of the eye is treated with different frequencies or combinations of frequencies depending on what it's trying to achieve. For the sake of this video, general eye health, eye wellness, 7 to 12 hertz is the ideal frequency. So what you're going to do is you're going to take your Y electrode connected to your device. You're going to close your eye and place the Y electrode on the closed eyelid. So not on an open eye, but close the eye, place it on the eyelid. Now you're going to deliver treatment for around 3 minutes to that eye at a comfortable power level. And then you're going to switch to the other closed eye and do the same thing for 3 minutes. Then you're going to place the eye mask on and deliver the same treatment for 3 minutes. Not as effective as the goggles, but certainly better than nothing at all. The process here, while simple, allows us to deliver the current in a similar way to the goggles, even though it's not simultaneous. You're getting all the pressure points around the eyes, or the majority of them, as well as the direct eye treatment. And it may be split up, it may not be simultaneous, but you're getting the best that we can offer in an absence of the goggles. You've got a little note here as well, but while microcurrent is practiced commonly in Europe, it is not FDA approved for the treatment of eyes. So this is not meant to constitute a substitute for medical advice or anything like that. I anticipate that this video will be on our YouTube channel. And this is our process for it, but it is an off-label treatment. If you decide to do it, it is not approved by the FDA or the health authorities in North America. All right, well, a little bit out of the way, but this is a very important treatment concept, and it can certainly be a good holdover as we're waiting for the microcurrent goggles. If you're waiting for them or you're anticipating getting them in the future, this is a good way of getting started with eye treatment for sure. The other alternative is to get in there and to use scalar energy. And this one is another option for sure, but I do not find it as effective as the goggles for eye therapy. So if you have the goggles, use them over the scalar or use both. But you could use either the Hache or the scalar chi here and simply place, and I've got Hache. I actually no longer have my scalar chi in the office since the Hache includes scalar. But you turn your device on, you set it to blue stimulation, which I will find here in a moment on my Pinnacle. There's lots of options there. Turn the Hache on if you're using the Hache, flip the switch. You'll know you're going to get the light, right? So you're going to see the lights come on the Hache. You don't want to look at this directly. So you place the scalar on your temple and you put it at that max power or that level you can feel it. And then you're going to go to the other side and place it on your temple as well. And you're going to do about 5 minutes per side. Obviously, if you're using the Scalar Chi standalone device, it does not have lights. So you don't have to worry about the lights there at all. But just 5 minutes of treatment per side, really a maximum or minimum would be 5 minutes per side. You could do a little bit longer with the scalar because it is kind of at a very natural frequency wave form. But that is another option to treat eyes when you don't have the goggles as well. Okay, I think I've unshared my screen there. Okay, so all of these processes are very useful to know and to have in your treatment bank. So keep that in mind as you move forward with the different treatments that you're trying to achieve. And hopefully you found this video useful. That is officially it for today's 10-minute training. The eye mask here is available on the Santa shop. It's like $16. It's a conductive pad, right? So it's not a super expensive piece of equipment. But it does help with that simultaneous delivery around the eyes, which is what really brings in the circulation and the nutrients. So anyway, that's it for today's 10-minute training, short but sweet, and very important for many of you on the wait list for goggles or waiting for the next batch to land with us. One of our priorities this year is fixing the goggle issue. This is 2024 for those of you watching in the future. And we're working tirelessly to make them available to everyone within the next few months with no more delays. But for now, or in the future, if you just don't have the goggles, these are alternative ways to treat your eyes without the need for the microcurrent goggles. So thank you for joining me, everyone. I will see you next week for another Monday 10-minute training. Take care.